Hi, I'm Dr. Harry Adelson coming to you from Docere Clinics here in Park City, Utah. Today's question is image guidance required for treating musculoskeletal pain? And the answer is absolutely yes. If you're treating an arthritic hip or an arthritic knee, or if someone has low back pain or neck pain, if you're not using some form of image guidance, you have no idea where the needle's going. So you don't know if you're delivering the stem cells to the area where they need to go. Now, for some things you can get close, certain intramuscular injections, but when you're talking about an intraarticular injection, especially like a hip or a knee or an intervertebral disc, it has to be precisely on target because there's very little blood flow inside joints and inside intervertebral discs. So if you're not getting the needle inside, then you're not getting stem cells to the area. I've had lots of people over the years I've spoken to have said, oh, I had stem cell therapy once and it didn't work. Well, did they use image guidance? No, but how hard is it to inject a hip? Well, surprisingly, it's pretty hard. The research shows that the miss rate for people just doing what we call blind injection is staggeringly high. You would think the hip is this massive joint, but it's actually quite hard to know whether or not you're there. There's two main types of image guidance. One is ultrasound and the other is fluoroscopy. Ultrasound is the same as for looking at a baby, except instead of looking at the baby, we're looking at your musculoskeletal structure, whether it's your facet joints, whether it's your rotator cuff, your Achilles tendon, whatever. What's nice about ultrasound is you see all the soft tissues. So you see the needle go right into, say, a torn rotator cuff. Next, we go to fluoroscopy, which, by the way, means X-ray guided injection. We use something called a C-arm because it looks like a big letter C. The X-ray tube is on one side and we can turn it so we can see in different orientations. This is a wonderful tool for injecting, say, intervertebral discs or spine injections, or certainly for doing bone marrow aspirations, because you see the bone with X-ray. It's not like X-ray, it is X-ray. The reason it's so important to use image guidance for treating musculoskeletal pain disorders is because frequently the areas that are the most painful have the least blood flow. Intervertebral discs, for instance, are avascular. It means it has no blood flow. So if you get close to the area, the stem cells aren't going to make it into the disc. This is also part of the reason why they tend to be the most painful, because it's the areas that are most difficult to heal after injury just naturally. So once again, if you decide to undergo stem cell therapy, make sure whoever it is you receive it from either does ultrasound guided injection or X-ray guided injection, or ideally both, which is what we do. We use X-ray for certain structures, such as injecting into joints, and ultrasound for other when we're injecting into soft tissue, such as a rotator cuff. If you'd like to learn more about stem cell therapy and the way we do it here, have a look at my film, The Stem Cell Solution. There's a link below. It'll take you to it. It's free to watch. I hope you enjoy it.